We're hearing people say, I'm spending 3 to 4 hours less per week on overtime. I'm getting home on time. I'm getting to my family. And they're really happy and grateful for that. Some people are saying they can't imagine a life without Heidi now. My name is Nugawela. I'm the General Manager of Strategy and Innovation for Greencross Vets. Today we are at Greencross Vet Hospital. It's one of our multidisciplinary and specialist hospitals here in Melbourne, and it's with our partnership with the University of Melbourne. So inside this hospital, we've got our GP department, we've got our emergency department, and we've got our specialty departments as well. And we're also fortunate enough to have our students here from the University of Melbourne. I studied veterinary science at University at Murdoch over in WA. Our veterinarians need to write their clinical notes live whilst they're in a consult or between consults to make sure they capture all the patient history. You don't want to have your back to the client and impact the relationship. You want to be focused on the patient when you're in a consult. I first got introduced when we were doing our review of multiple options that are out there for voice to text software at the start of this year. And that's when I met the Heidi Health team. I had a great first impression. It's a product made by clinicians for clinicians, and it has been adapted to be suitable for our sector because we've got quite a niche sector with a lot of very specific veterinary nomenclature and things that just don't translate in other sectors. And that's why we've struggled to find something that meets our needs. So I was really excited that it was a product made by clinicians.
My name is Luke Johnston. I'm a registered specialist in small animal internal medicine, and I'm head of department of the medicine department at GVH University of Melbourne. One of my passions is teaching and education. That's why I work here. The value of having that contact with students and helping them evolve a critical mind in internal medicine is incredibly important to me. If I can achieve that for a student, then I've fulfilled my role. I think we're critical thinkers, we're scientists, and we need to approach what we do every day in medicine like that. Greencross has invested in Heidi, the premium version for all veterinarians. There was more access to information and more access to the abilities that the service would provide for us. But there's also additional training as well, which I thought was really, really helpful. I've been able to sort of mold the templates with Heidi and really sort of delve into the assessments and what I'm talking about and what my differentials are and what my plans are. It is able to transcribe that, really accurately. I used to hate sitting down at the end of the day, having to write my records. Sometimes spend hours and hours doing them, going home, doing them on the weekends. If I can do that in the consult setting and I walk out of there and all my records are done, there's nothing more pleasing to me, and I can walk out of the door at 6 p.m. at night when my shift finishes and I can go home and spend time doing the things that I love. It's not what you can do on a day-to-day basis that will make a difference. It's how you can impact the other people in your lives and what they will then be able to do with that impact. I can only help a certain amount of animals day to day, but if I can help others to help animals, exponentially my impact is greater. The effect for Heidi on the team for me is more about sort of time management and having to get rid of the things that don't really give my team a lot of fulfillment, time to do the things that really make them feel fulfilled and valued in their job. And as a team leader, that's really important to me because I want them to come to work and love what they do every day. I think for me, Heidi's kind of streamlined my job quite a lot, and I rely on it to help me to write my records and keep track of the patients that I'm seeing. So if that kind of disappeared for me, that would be really difficult. At the end of the day, spending a lot more time on writing records and not in front of patients and helping them.
I think from my perspective, I would notice that the morale of our teams would definitely go down. This is something that we've really introduced to support our vets and vet nurses, but it's also been adopted as the way of working. Some people, Heidi's now autopilot.
In terms of training for AI, I think there's a huge realm of there are possibilities of how we can access that and utilize that in training programs. And I think we need to be smarter about the sustainability of this industry, and AI has to play a role in that. And I think we just need to start getting on board with that.